A pleasant good evening once again to our viewing and listening audience, and welcome to another session of HealthWise, a program organized by the St. Kitts and Nevis Medical and Dental Association and your nation's station, ZIZ Television. The aim of our program is to educate and inform our people about selected topics with the involvement of persons who are working in that specific area for an extended period of time. So they bring with them their experiences and their knowledge to share with the general public. Of course, at the end of the day, by virtue of them volunteering their time to spread this information, that would help to make us all health wiser. Tonight, we are entertaining the dentists. We are entertaining that area of medicine which lots of people have fears about because of a variety of reasons which will come to the fore tonight. We will be looking at various myths, various sayings, various hearsay stuff about what goes on in the mouth. And to help me in this vein, we have three dentists, three local dentists, born and bred right here in the Federation of St. Kitts and Nevis. On my immediate left, I have Dr. Therese Rollins. Good evening. Good evening. On my immediate right, I have Dr. Randy Liebert. Good evening.
Good evening.
And on the extreme right, I have Dr. Trevor Christmas.
Good evening.
Good evening once again. So we have a very impressive panel of local dentists here to help me through navigate the waters as we try to shed more light on the fears and the cares associated with dentistry. We, of course, have no intentions of doing any extractions tonight, but rather to fill you in on information that is relevant to the area of dentistry. Now, let us start first with the fears as it relates to dentistry. Is it common, Dr. Liebert, is it common to be of the opinion that people fear dentists?
What happens is that most persons, they tend to be afraid of the unknown. And sometimes what happens is that parents tend to try to punish their child by telling them, if you don't behave, I'm going to take you to the dentist, and the dentist is going to give you a hard injection and pull out your teeth out. And they instill that fear, and the child actually grows up with that fear. And it sort of made it a little bit more difficult for we as the dentist to treat that patient, because even though we try to talk them to the procedure, explain to them, okay, this is what we're going to do, this is not going to happen, because they have that fear from being small and getting punished by coming to the dentist. From one bad experience, it makes it a bit more difficult to get dental treatment.
Dr. Rollins? As it relates to the fears, because I know as I was growing up, I always had that fear. And the fears for me was the sound of that drill, as if it was going through my head.
Well, yes, to add to what you were saying about the fears, one of the things we encounter too is like an inherited fear, where persons would have heard the stories at home, and even though they may not have been to the dentist themselves, they heard the stories and they, sort of made it their own, and they inherited that fear of the dentist. Plus, we still also hear stories about previous dentists who lived and worked in St. Kitts many years ago, and strangely enough, some of the fears that existed in the persons who saw those particular dentists at that time sort of became passed down to their offspring, and today that some of that fear is still with us.
So in other words, those dentists are gone, but they've left the fears with us.
Something like that.
Dr.
Yes.
Christmas, any comments as far as you see the fears?
I think most persons, they're fearful of the injection. That's one of the common concern that persons would speak about when they come to the dentist. The first thing they would ask is, am I going to get an injection today? If you're fearful of doing a blood test, most likely you're going to be fearful of coming to the dentist also, because the first thing that they think about is a needle. That's all they have in their mind once they get in. Sometimes some of them say they want to see the size of the needle. They're just concerned about this needle.
Okay, yeah, I can understand that very well because, like I said, from small up to now, a dentist is not exactly a place that I look forward to visiting. But my concern was the sound of that drill, that fast drill. I think you guys have two speeds, and for whatever reason, the one that goes faster, it somehow seems to trigger in my mind that something bad is going to happen. And so I am really concerned. I tend to follow the hands of the dentist to see if he's going for the fast drill or the slow drill. And if the fast drill is coming, then I'm, oh, wow, how long will this last? So that goes as far as the fear is concerned. Now, good dental care is important. I know many people think that it's enough to go into the bathroom, grab the brush, and just do something, wiggle the brush around, and then come out. And I would want to think that that is not what we can start off by saying is good dental care. So, Dr. Liebert, can you give a basic idea as to what good dental care should look like when I enter the bathroom in the morning with toothbrush in hand and toothpaste or whatever? What should be done? How should it be done?
Okay, normally what happens is that in terms of oral hygiene, we always tend to encourage brushing and flossing. Brushing should last for at least approximately 3 minutes. Most persons actually go in the bathroom and not even spend 30 seconds. So you spend at least 3 minutes and you have to get in, you have to brush all your teeth and all the different areas. And from small, we get accustomed to brushing across because that is more comfortable and that is what we know. But the proper way of brushing is actually angling the toothbrush at 45 degrees, and there's a sweeping motion. So for the top teeth, you actually brush down away from the gums. And for the bottom teeth, you brush up away from the gums. When we brush across, we're actually doing two things. One, we're actually impacting the food on the gum line, so the food gonna stay there and plaque gonna build up on the food, and then you get what we call gingivitis. And two, if you're using a hard toothbrush or what we call smoker's toothbrush, you tend to brush away the enamel from the neck of the tooth, and you can develop sensitivity over a period of time.
It seems so natural for me to just do this. It seems like a natural action. It seems rather unnatural doing this. And I know that I am guilty on many occasions. For one, I don't have the 3 minutes because I'm hustling. And two, it just comes like, I feel I'm doing something when I'm doing this. I don't feel I'm doing something when I'm doing this. Any comments?
Yes, I think most persons have grown accustomed to that particular way of brushing. But as we want to emphasize, as Dr. Liebert was saying, that the proper way and to get the most out of your brushing experience is to angle that brush at a 45-degree angle, as he said. And with the top teeth, you sweep downwards, and the bottom teeth, you sweep upwards. You create less damage that way, and you get more of the plaque removed, and as he said, not to get it embedded underneath the gums. So we have to make that conscious effort. It is difficult to me to change our ways, but it really makes a difference, and it's good to make that effort in order to change the way we brush in order to get the most out of your brushing.
Dr. Christmas, any suggestion in relation to brush choice? A hard brush, a softer brush? Is it just depends on me, what I prefer?
Recommend a soft toothbrush. For persons who are accustomed to using a hard toothbrush, once we make that recommendation to transition to a soft toothbrush, they normally say, well, I don't feel like my teeth is getting brushed with a soft toothbrush.
I certainly don't.
But the hard toothbrush, it does quite a bit of damage, irreparable damage, because once you start with that hard toothbrush, not only just the enamel you wear away, but you also wear away the soft gum tissues around the neck of those teeth. And over time, one of the results of that is that you would be experiencing sensitivity from that action of the toothbrush. So it's really important that you use a soft toothbrush. If it's too hard to go from a hard to a soft, maybe you could step down to a medium and then you step down to a soft toothbrush as you get accustomed to it.
I think that's important for me and for those listening, because I really thought that I was doing much more with a hard toothbrush. I actually felt the feeling that it's getting clean by virtue of having that harder brush. But this does make sense. This does make sense. Dr. Liban?
The idea behind the soft toothbrush is that you're supposed to brush your teeth immediately after eating, which means that the food is still soft on your teeth and it can be removed with the soft toothbrush. Right?
So, yeah, go ahead.
And in terms of brushing your teeth, it's not only the buccal or outside surfaces. You have to brush the biting surfaces and on the inside also. And then it's also important to brush your tongue and the roof of your mouth. Reason being is that your tongue is filled with small filaments, sponge-like. So it's like food tend to get trapped. So you find that for some persons, their tongue gonna look white or yellow. Let's say you drink a red soda, you see that your tongue actually turns red. That's because all the sediments is trapped in the filament, so you need to brush your tongue. Otherwise, bacteria too gonna build up on your tongue as it builds up on your teeth. And it's the same thing for the roof of your mouth. The roof of your mouth have like certain grooves in it, so food can get trapped in there, so you need to brush the roof of your mouth also. It's not only your teeth, but then the whole oral cavity.
Well, I must admit I'm learning a few things here in my senior age, because, you know, I would not have believed that I would be here 10, 15 minutes into the program just talking about brushing and learning a few things. Many people are unaware of the importance of brushing at the biting surface. Dr. Liban, as you spoke about it, I think most people I figure focus on that outer part, that buccal part as we refer to it as, and probably do not spend a lot of time on the inner surface, and probably even less people focus on that biting surface. So I'm glad that you explained the importance of doing that. And before we go to our first break, which will be shortly, if we can now address the flossing part, because I think somebody spoke about flossing, the importance of flossing. How does that add into the picture? And one more question before I break. There's so many things about this brushing, boy.
Yeah.
The number of times, because you did speak about brushing with every meal. So if I'm eating 5 times a day, comments from you guys as to if I should be brushing 5 times a day. Who's going to shoot first?
To encourage our patients to floss. It is usually the required amount of times is usually once per day, usually in the evening. But sometimes if you find that during the day, if you can get that, if you can brush 3 times a day, we recommend that also. But sometimes most persons would say that they wouldn't be able to get that, maybe that lunchtime brush in. They would only brush in the morning after breakfast and in the evening after supper. So if you can get that lunchtime brushing, we encourage that as well. With the flossing, if sometimes persons might have food lodged in between their teeth, let's say at lunchtime, well, you can, if you have your floss with you at work or at school, you can floss at that time also, just to prevent the remove that piece of food that may be lodged between your teeth, because that is how the decay process begins between the teeth.
Okay, well, we have, believe it or not, completed the first 15 minutes of our program. And so we're going to take a short break for station identification. When we return, we will continue this discussion about brushing and cleaning and flossing and so on. And we will actually add or ask the question, is it important to do some washing out with the Listerines and all those various fancy smelling, fancy tasting liquids which are sold in our various supermarkets. So after this break for station identification, we will be right back.
Debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on?
Tony Frederick!
You've just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here. Always here. Always here.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basse-Terre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Okay, welcome back to HealthWise, and tonight we have as our guests the dentists. Those guys who apparently lots of people have fears when it comes to visiting them, but their importance can never be underscored, can never be forgotten, because without nice looking teeth, we would have to be smiling like this, you know, and hiding. And most people would love to be able to smile and show their teeth. So we have tonight Dr. Therese Rollins, Dr. Randy Liebert, and Dr. Trevor Christmas. And we're speaking about a variety of issues as it relates to your teeth. Now, Dr. Liebert, you wanted to add something about the cleaning process?
Yes. One of the main reasons for flossing is that when you brush your teeth, the bristles of a toothbrush don't get in between your teeth. So you need to floss to take the food out of your teeth. Because some persons might say, like, if I don't brush my teeth, why should I floss? Well, that's one of the main reasons for flossing. And also, there are two types of floss. There's a wax floss and the unwaxed floss. Sometimes because your teeth are very close, it's recommended that you use the wax floss. But then if you're going to use the wax floss, we ask that you floss before you brush your teeth. So when you brush your teeth, you can actually remove the wax that remains between your teeth.
Okay, and Dr. Christmas, you had some an addition to?
In terms of the frequency of brushing, it is recommended that one brush their teeth after every meal. You know, some persons might say, well, they can't brush when they're out at work after lunch because the conditions are not the best. But for demonstration purposes, let's imagine that you were eating food that had a red color. You had a red color food for breakfast, and you brush your teeth before you eat, and you decide you're not brushing after. Can you picture what color your teeth is going to be afterwards? And you go to lunch, you eat that same red color food, and you don't brush. Again, you have some red teeth after lunchtime. The same thing happens after dinner. And there are some persons, they don't just eat after breakfast, lunch, and dinner. They snack in between. So every time you eat, you're basically putting food on your teeth. So this is why we're asking you to brush after every meal, because you eliminate that food that builds up on your teeth after you eat. So it's very important, the mechanical action of the toothbrush, it takes the food off and it basically gives you a clean environment, a clean surface on your teeth. So it's very important that you do that brushing regularly. I mean, it doesn't take much to have a small bottle of water and a toothbrush. You could go in any corner, don't care where you are. I mean, sometimes persons who work on the road in parks and beaches, they would say things like, "But I can't brush my teeth when I'm out at work," but all it takes is just a simple bottle of water and your toothbrush and some toothpaste, and you could do that job right there.
Dr. Rollins, any benefit to the teeth, to the health of your teeth with these mouthwashes and all those various things people always add after they finish brushing? Any benefit?
Well, to me, it seems to me that with the mouthwash, it just sort of leaves your mouth feeling clean. It's sort of like the finishing touch after the brushing. It's a finishing touch in terms of having your mouth have that, enhancing that clean feeling.
But it's not necessary.
So you don't necessarily have to, but the disadvantage to it can be sometimes is that they contain a certain level of alcohol, which can leave you with a dry, kind of dry mouth feeling. So you might need to, don't overuse the mouthwash. Use a moderate amount just to have enhanced that brush in the clean feeling. There are also what we call fluoride rinses. Now those we as dentists would recommend to persons with specific conditions. Perhaps they may have a lot of cavities. So we want to enhance the exposure to fluoride, which is the cavity fighting ingredient that is in the toothpaste. So to enhance that, we would recommend what we call a fluoride rinse. The purpose of that is just to expose the patient to more fluoride, more anti-cavity fighting chemical ingredient that will help to prevent cavities.
Okay, what I want to do now, I want to look at some myths, some misconceptions, and some bad practices that exist in dentistry. And you can, of course, correct me if I'm wrong, because I'm no dentist. I'm the little flea here on the wall watching on, amongst the dentists here. Now, pregnant women, there's talk about dental treatment being administered during pregnancy, and in some quarters, people would say, no, wait until after the baby is delivered. Let me go to the female first. Dr. Rollins, is that right or is that wrong?
We encourage dental care at all times. However, when we see a patient who is pregnant, one of the first questions we ask them is, what trimester are they in? So usually we would want to recommend dental care if she's in her second trimester. That is when we would do mostly all the dental care that she's asking for. If the person has an emergency, for example, a toothache, then we would need to act on that right away, because we can't have her in pain all throughout the entire pregnancy. So we would definitely deal with that at that time.
So a pregnancy does not hinder one from seeking dental care?
No, it doesn't actually. And in fact, we do recommend it strongly, because it has been said in the literature that if someone has poor oral health, it can affect the birth weight of the baby. So we do recommend the pregnant women see their dentist as usual during their pregnancy for their regular cleanings, just to keep the oral health keep them in good oral health status.
And Dr. Leiber, they talk about children in utero, that is in the pregnancy, causing the mother's teeth to get weaker because the child is drawing on the calcium from that pregnant woman's teeth. Fact, or that is just, street talk?
Okay, I want to ask a question before I actually respond to that question. If the baby is drawing calcium from the mother's teeth, the bones of the body is actually made up of calcium. Why is it that the mother not getting multiple fractures because the baby is sucking the calcium? Why is it specific that the baby is actually sucking calcium from the teeth and not from the bones?
Good question. Good
Right?
question.
So it means that that is a myth. What actually happens is that because of all the different hormonal changes the expectant mother is going through, it leaves the mother at a higher risk of getting dental cavities or the periodontal issues. So that's why we recommend you get dental care. What actually happens is that, let's say we have to administer or we have to prescribe medication. That is where the tricky part comes in. So after the first trimester where the baby is already formed, the baby is actually only growing. So that's why dental treatment can be done during the second trimester. So what we normally do is actually find out who is the attending physician or obstetrician, and okay, we make contact with them saying, okay, this is your patient and we need to do X, Y, Z. Can we give this type of medication? So they actually authorize the medication we're giving. If it's that we cannot get in touch with the doctor, we actually give the prescription and ask the patient, go to your gynecologist and let them know, okay, that you went to the dentist and this is what he prescribed, can I take these? So we never deny treatment, although they are pregnant. It's recommended that you get the treatment done. Like Dr. Wadin said, one of the issues is preterm birth and underweight, because if the mother cannot eat properly because of toothache, how can the baby get enough nutrients to grow properly? So it's important that you get dental treatment done, preferably before you get pregnant, but because those things are not planned all the time, you actually have to get the treatment done so that you can be healthy, because your overall health can be beneficial for the health of your unborn.
Dr. Christmas, when you have myths that abound and misconceptions, I always preface my statements by saying, they say that a patient should not go out at night in the dew after he has an extraction done. Is there any truth in that?
Well, that is indeed a myth. There is no truth to that. I do extractions at nights for many patients, and I've never had a complication where the person returned and said because they had the extraction done at night, they ended up with problems. Most of the times, once we do an extraction, we give indications as to what a patient is supposed to do. And once these instructions are followed, the patient should have proper healing. They should be without any problem. So it's a myth to think that you can't go out in the dew, you can't wash your hair, you can't cook after you do an extraction.
I know that as a result of an extraction, there's a fair amount of blood in some cases, especially perhaps when you're removing those big fellas at the back. And with that blood, it may end up being swallowed. Any comments on that, Dr. Rollins, in relation to the swallowing of the blood after an extraction?
That's always one of the first concerns that patients express, because our immediate instructions are to, one, bite on the cotton for 1 hour. And then after removing the cotton or the gauze, we instruct the patient that they cannot rinse, they cannot spit, they cannot rinse out their mouth that day. And one of the first things patients say, but I have to swallow? And you see the dismay on their faces, and they're quite disturbed about that. But I usually tell them, but it's your blood, it's all you, it's no one else's. So it is very important that after they have that extraction, they have to bite down on that piece of gauze and obey the instructions that the dentist gave. After the cotton comes out in an hour, if there is some bleeding or buildup of saliva, it is okay to swallow. You will not be harmed.
Okay, I think that is a very important piece of information there, because that's always the case, after the cotton is gone, and saliva, of course, starts being produced, and it has in the pinkish, reddish color, everybody is looking to spit, and because they're thinking it might be wrong to swallow, it may be causing some problems. So I'm glad you were able to shed some light on that particular aspect of it. Of course, after the extraction, the rinsing, you have a variety of things that some people tend to reach for, whether it be salt water, seawater, whether it be peroxide, whether it be Listerine. Any advantages, disadvantages, any facts in that, Dr. Leiber?
Use your national bank.
Shouldn't I?
Okay,
Maybe reach for a beer?
Okay, one of the most important things is, as we stressing, is to follow the instructions. Like in some persons, because like you said, there might be some bleeding, they want to like get rid of that. But the most important thing is that when you bite on the cotton, what we're trying to do is form a blood clot. So if you go on wings immediately, you're gonna wash away the blood clot and then you're gonna continue bleeding. But in the healing process, we recommend that after 24 hours of having the instruction, you can rinse your mouth to prevent food from collecting in the socket or the extraction site. So we recommend that you rinse in warm salt water to actually prevent food from collecting. They're gonna delay the healing process, or you can get what we call a dry socket. That's like a partial infection of the area. So some persons might ask, can I go down the bear and just rinse up my mouth and everything? No. We want a specific concentration of the solution. So it's actually a tablespoon to a full liter of water, and then you do the wings as often as possible during the...
A tablespoon, you said?
Of salt to a liter of warm water, with lukewarm water, and you do the wings as often as possible during the course of the day. The issue with the hydrogen peroxide is that like they're gonna fuzz and actually help stop the bleeding, but after 24 hours you should not have any bleeding because the blood clot has already formed properly. Same thing goes for the Listerine and everything. So the more ideal solution is the warm salt water. That's going to prevent any food collecting and not going to disrupt the blood clot and delay the healing process.
Okay, we are at the top of the hour already. Time is flying, leaps and bounds. And so we have to take another break for station identification. At this time, we want to invite the general public to, if you have any questions, if you have any comments, suggestions, recommendations, or fears as it relates to dentistry, you will be able to call us here at the following numbers: 466-2666 or 662-8674, 767-4765, and the overseas line 1-239-645-4500. And as such, we will be right back after this break for station identification.
Use your National Bank Visa debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on?
Tony Frederick!
You just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here. Always here. Always here.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basse-Terre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Okay, welcome back to HealthWise. Tonight we have the dentist with us, and we are looking at a variety of issues as it relates to visits to the dentist, the fares and the care that you can get when you're there. Now, we are at the point of talking about some home remedies for toothache. I'm sure everybody at some time would have experienced that toothache, that nagging ache from the teeth, and would be wondering, what do I have in the house that I can use to address the toothache before I go to the dentist, who I fear? So, Dr. Rollins, any suggestions? I've heard about clove, for example, and garlic. Anything makes sense with those two?
Well, as far as the clove goes, a lot of patients do tell us that they do have applied that to a toothache. Let's say they were at home and they would have used a clove itself, crushed it, and applied it to the area. And they said that they did really receive relief. Indeed, one of our dental materials, one of our filling materials, is made from the same clove oil. It does have that soothing feeling. It does have that soothing feeling. So, indeed, we have seen that we prove that clove oil is one of a good remedy. But we do not encourage persons to take that aspect of dental care into their own hands. We do recommend, suggest, encourage you to see your dentist as soon as possible. In fact, see your dentist before the toothache occurs. Therefore, the tooth can be addressed before the toothache occurs.
All right. Dr. Liebert, what's your experience with the garlic and a shot of rum, perhaps, maybe, a shot of Hammond inside there as a home remedy to address this nagging toothache? Saturday evening, dentist not open, and I don't know if people can go to the emergency room. So you look around the house and you see some Hammond on the shelf, some rum. Is there anything in that may be of help? Any experience you have with that?
Yes, we have heard of the garlic. What happens is that the garlic has an antiseptic mechanism towards it, so you tend to get relief from the garlic. But in terms of the Hammond, this is common. I don't know if it's the effect of the concentration of the alcohol content itself, or probably when you take Hammond, it's like you get an instant high that you tend to just fall asleep. They can forget about the toothache, especially if it's the kind that is actually have marijuana soaked into it over a period of time.
Wow.
And you take just one shot of that and you're out cold in no time. So I've heard of the Hammond and I've heard of the garlic as home remedies.
Yeah, what's your experience, Dr. Christmas, with these home remedies and pain? Somebody mentioned shilling oil, and you have any specific experience that you can share of, in relation to the home treatment for the toothache before you can get to the dentist?
What we've recognized is that persons tend to do a lot of, when we look back, we consider them to be ridiculous things just to cure a toothache. I've had a patient who told me at one point in time they actually used hot pepper sauce on a tooth that was hurting them. And I can tell you that most times you get a toothache, it's in the middle of the night and a long holiday weekend.
Exactly.
So persons are forced to basically do their own home remedies. The shilling oil, I've heard about it also, but I don't know if it's that effective. I know about the clove and the garlic, but the shilling oil, I don't know how effective that is. I've never really had much experience with persons getting relief from using shilling oil.
Well, you see, you must understand that in the presence of pain is something that nobody likes. Nobody wants to endure pain for an extended period of time. And we do have situations and circumstances, like, as you said, on a long weekend, Saturday night when the next dental place to be opened would be on Monday. And I'm not sure if dental emergencies are addressed at our emergency center at the hospital. So people would obviously be looking for various strategies, various things to try. And that is why I initiated the conversation on these various techniques to see if there's any particular one that stood out, any particular one that, as a group of dentists here, y'all will say, well, try that until you get to the dentist, with it tomorrow or whensoever it may be. Of course, left to me, I would say take 2 paracetamol, because more than likely, you know, that has been designed to treat pain, you know, and I certainly have no experience in dental pain and any of these things, so I certainly will have to follow the lead set by the dentist. And if the thinking is that clove can be of some help, perhaps one of these days I'll give it a try. If garlic is the thing, I'll definitely give it a try. And any follow-ups to that? Any follow-ups to the dental pain? Or we can move on perhaps to children, pediatrics. This is going to be a solid question. And I often even wondered when I was a child. And I vividly remember, because my mother religiously took me to the dentist, and we used to fall out, you know, because I used to tell her my mouth feel good. Even if I had a little pain, I would hide it, because I know going dentist means drilling and digging and so on. So I would hide it. But why should I fill a baby's tooth, the so-called milk teeth, when ultimately and eventually it will fall out? Are they filled? Is there a thing, Dr. Rollins? Do we fill those teeth?
Yes, if the tooth has if the patient presents to us with a cavity in their baby tooth, a lot of times the parent will ask that same question: why should this tooth be filled when it's going to fall out? But usually I ask, my follow-up question to them is, well, if it's taken out prematurely, how will your child eat? And then that's followed by, well, he can eat or she can eat, soft things, you know, that kind of thing. But there are reasons why we have baby teeth. They help us. They help the children to eat. They help the children to speak. They help the children to smile and improve their self-esteem. So there are different reasons why we have baby teeth. And that is why it is important to take care of them until the time for them to fall out. Yeah, we do. And if the tooth can be filled, we do encourage the filling to be done, because the child still needs to eat, the child still needs to speak, and the child still needs to smile.
Anything to add to that, Dr. Liva?
I would like to add to this, because this is basically part of my specialty. It's like the baby teeth. One of the more...
Is the term milk teeth used still? I don't know.
Okay, the idea behind the term milk teeth is because the baby teeth, in terms of color, they look whiter than the permanent teeth. So that's where they get the term baby teeth from. But these teeth, one of the primary reasons for saving the baby teeth is that they're used to guide the permanent teeth into the correct spaces. What happens is that you get a cavity untreated, you take out, you get an extraction done. What most parents don't know is that each set of baby teeth have a specific year for the permanent teeth to actually goes in the mouth. So, for example, the second molar in the baby teeth, that actually grows in at 11, 12 years. So if you take out that at 5, 6 years, it means that you have 4, 5, 6 years waiting for that teeth to go. So what's going to happen is that the adjacent teeth going to shift, going to migrate into the space and close the space. So when that child becomes 11, 12 years, there's no space for the permanent teeth to go. So it means that you're going to come out wherever it wants on this side, and then you have bigger issues where you have to get braces done to actually align and put that tooth into the correct space. So it's important to save the baby teeth as long as possible so they can guide the permanent teeth into the correct space, apart from the functions of eating, smiling, speaking, and those kind of things.
And we are at 9:15 already, and so we are at the stage for another break for station identification. But we just want to invite our listening and viewing audience, if you have any fears in relation to the care offered by the dentist, if you have any questions, comments, suggestions, or recommendations, you can call us here at 466-2666 or 662-8674. The numbers are on your screen, 767 4765, and you have the overseas line 239-645-4500. And as such, we will be back to continue our discussion about dental issues after this break.
Use your National Bank Visa debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on?
Tony Frederick.
You've just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here. Always here.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basse-Terre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Okay, welcome back to HealthWise, where we are talking with the dentists. And we're looking at a variety of issues, some myths, some misconceptions, and some of the facts associated with dentistry and visits to the dentist. We were just a while ago talking about the babies and the teeth and whether they should be filled or, or not filled. And I think Dr. Christmas, you wanted to add something to it.
Having extractions done prematurely is that the gums, when they heal really firm. So you find the permanent teeth, even though they're erupting, they might not have that eruptive force to penetrate the gums. Like Dr. Liebert mentioned earlier, the baby teeth, they act as a guide for the permanent ones. So if these extractions are done, let's say at 3 years, you find the gum heals over that period, where sometimes you find up to 8 years a child who should be having their front teeth and you're not seeing it because the gums are healed so hard that the teeth are encountering some difficulties in terms of erupting to their proper position.
All right, so we, I think, are now well advised as to how to proceed with the children and the fillings and extractions and so on. And I hope that advice is taken on board. Dr. Rollins, children often would fall asleep with a variety of things in their mouth, and which may or may not have an impact on the growth of the teeth, whether it be the breast, if they're sucking breast, or the bottle, or the pacifiers. Any comments initially on the breast and the bottle?
Yes. Often we encounter patients where the baby teeth are extremely decayed, often look very destroyed, and the first question we would ask the parent is, was this child allowed to fall asleep with the breast or the bottle in their mouth? And many times they would admit and said yes, one or the other, and we would then proceed to discourage them from doing that practice, because what happens is if the child falls asleep with the breast or the bottle in the mouth, the the sugar that's contained in the milk stays on the teeth and often causes decay. And if it's done regularly, if it's done pretty often, the decay becomes very aggressive. So you find that at a very young age, 2, 3 years old, the front teeth, sometimes they're brown, sometimes they're black. And that is decay that has been formed. And it's very unfortunate that this happens at such a young age, because those teeth would not be ready to lose those teeth until they're about maybe age 5 into 6 years old.
Okay, that's an important comment there, but one thing I wanted to plug in here is this famous tool called the pacifier. At some stage, it was a very popular device used to quieten those children, when they bawl, as we say, and they cry out. You see the mother reaching into the bag and grabbing this thing and, as we say locally, shove it into the mouth or place it into the mouth of the children, the pacifier. Dr. Liebert, give me some insight as to the usefulness or lack thereof of the pacifier.
One of the disadvantages of the pacifier is that some parents would actually dip the pacifier in sugar, honey, and actually insert it into the child's mouth. So what you find happening is that the child can get what we call baby bottle caries, as Dr. Wallins suggested. That's all the teeth are decayed. And then some parents might say, but my child don't eat sweetie, how come all the teeth are rotten? So it comes from the bottle remaining in the mouth of the breast and the pacifier, and they don't actually clean the child's mouth after having these things in the mouth. But another thing, with the pacifier, okay, when they're sucking the breast, they actually extend the tongue so that the milk can be collected on the tongue and they swallow. That's a normal swallowing pattern for a baby. But from you start to get your front teeth, automatically supposed to change over to the adult pattern of swallowing, where you actually place your tongue behind your front teeth in the roof of your mouth and swallow. With prolonged use of the pacifier, you're actually extending the swallowing pattern of the baby teeth, and then you have where the tongue actually protrudes and push out the teeth of the baby. So some people might say, oh, my child never suck finger, so how come the teeth are cocked off and everything? But it's because of the pacifier and not changing over from the baby swallowing pattern to the adult pattern when they start having the first set of teeth. So even though I used to quiet the child, the disadvantage with prolonged use, you're going to have that issue, because the face is, bones in the face are already soft. So any unwanted force going to deform the face. So, and that's why we change over from exclusive breastfeeding to soft foods and everything, because the act of actually biting strengthens the face muscle that actually helps the bone in the face to go properly, because all the muscles are attached to the different bones in the face. So you need that mechanical action of biting down on raw foods, I will say, like the fruits, the apples and the vegetables, to help the child face to go properly.
So in conclusion, in relation to the pacifier, can I say that you're anti-pacifier or you're pro-pacifier, or it depends?
I'm neither here nor there. It's it can be used, but then when the child starts to get their first set of teeth, you should discontinue use.
Dr. Christmas?
Well, the pacifier, like Dr. Liebert said, we see a lot of damage from the pacifier. And my issue with the pacifier is that sometimes the parents, they're not supervising the child using a pacifier. So you find a pacifier could fall, and the pacifier is taken up and it goes straight back in the child's mouth. The child could be doing different things with a dirty hand touching the pacifier, so that in itself is a problem for that child. So in areas like that, I wouldn't recommend the pacifier.
Dr. Rollins, same question, pro, against, you're for, you're against, or?
Well, I would say that the pacifier, to me, the purpose of it is to be used
to
pacify when the child does not have any teeth. But once the teeth come in, I've seen a child where the child was still continuing to use the pacifier while the teeth were in, to the point where the teeth took on the shape of the pacifier.
Wow.
So the teeth were round, the shape of the front teeth was a circle, because the pacifier was always there. So I would say, as Dr. Leibert said, discontinue use once the teeth come in, because it's only supposed to be used when the child doesn't have any teeth.
Now, a question for the persons who are getting older. You know, I guess I sit here, I'm probably the least young here. Do teeth automatically fall out as one gets older? That, of course, would be of much concern to me, because I'm getting there, not there yet, but I'm getting there, so I would want to know if teeth automatically fall out as you get older. Dr. Rollins.
When patients ask that question, my second question to them usually is, well, when does old begin? Because in terms of teeth can fall out at any age, if we put it that way. Usually what happens is that in an older person, the reason why most likely they would lose their teeth is because they're experiencing what we call gum disease or periodontitis. And that happens where the tissues of the gum tissues become inflamed and they're not dealt with at the dentist, they're not cleaned, and the bacteria that's built up underneath the gums continues to spread and replicate and cause damage to the surrounding bone structure around each tooth. So once the bone structure around each tooth begins to disintegrate, the teeth begin to get mobile and get shaky. So after a while, if the teeth begin to get shaky, after a while, and the problem is not addressed, the teeth will fall out. Now that process can happen when somebody is 86. That process can also occur if the person is 35. Depends on how aggressive the form of gum disease that person has experienced. I've had experience where I had to tell a 38-year-old man that all your teeth are going to have to come out soon. And he was very disturbed about that learning that information. So in terms of the question about when you get old, your teeth are going to fall out, it's not so much the age, it's more the disease, the disease process that is overtaking your mouth, whether it's overtaking your mouth at age 35 or whether it's overtaking your mouth at age 70.
Okay, well, we are going to be right back after this last break for station identification, but what I'm going to give you a little insight into the question when we return is the fact that when I did return to St. Kitts many moons ago, I encountered an individual who was in their 20s with dentures. And it frightened me because when I left St. Kitts, for me, dentures was synonymous with age. And when I say age, with 60s and those sort of big numbers. So when I saw someone in their 20s with dentures, I was frightened. I was really frightened because I was wondering what had transpired, what could have happened. And the person appeared pretty healthy otherwise. So when we come back after this break for station identification, we will discuss that. And of course, we are still here inviting any calls, any questions, any comments. The numbers are on your screen, and we will be willing to address them. So we will be right back.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basseterre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Use your National Bank Visa debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on?
Tony Frederick!
You've just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here. Always here.
Okay, welcome back. So I did pose a very interesting comment, about encountering a young individual with dentures. And it caused me to think, what could have happened for somebody in their 20s who had a job, who had access to decent nourishment, good food, sunshine, right here in St. Kitts? What could have possibly happened in this particular case? Dr. Rollins.
Well, usually when persons wear dentures, it's because of some form of tooth loss. And tooth loss can occur, you could have had experienced an out-of-control gum disease experience, which resulted in tooth loss, or it could have occurred where you had, out-of-control tooth decay also, and could have resulted in tooth loss. So when we do dentures, they're not necessarily age-specific. Young people, middle-aged people, older persons can wear dentures. It's a form of replacing teeth that have been lost. And remember, the teeth that have been lost were useful. They were useful in smiling at one point in time. They were useful in eating. They were useful in speaking. So in order to maintain those functions, a person would have to use one of the forms of replacing teeth would be a denture.
Anything to add to that, Dr. Christmas, Dr. Lila?
Okay, like Dr. Therese said, in terms of tooth loss, well, for example, you can have tooth loss because of trauma. Let's say somebody who is 12 years playing basketball, get an elbow, the tooth can come out. Even though there's a procedure where we can reinsert the tooth based on the time has expired, so it means that we have to replace the function of that tooth. So we do a denture, and that because the patient is young and still going, we actually do that procedure of giving them a denture until it becomes 18, 20 years, where they stop going, and then we can actually put something more permanent. It's the function of having a denture. It varies based on the reason for the tooth loss.
Do we have any cases you guys are aware of with dentures in that sort of age range here in the Federation? Any experience with that? Dr. Christmas?
Yes, we see a number of cases where children would have had traumatic experiences, maybe a motor vehicle accident. Sometimes children fall down at school and unfortunately they lose their teeth. And one of the simplest way of rehabilitating that space is to give them a partial denture. Because apart from rehabilitating the space, it also allows them to maintain their self-esteem, to be able to relate to their peers. Because, a young child losing their teeth at an early stage, like the early teens, you know how traumatic that is.
Yep. People
tend to tease them, their peers tend to tease them and say different things. So it's important that you continue to give them that smile so that they could integrate normal with their peers.
Now, Dr. Leibert, when it comes to dentures, should people sleep in them? Is it wise, is it recommended that you have dentures 24/7, 365? Or you can take them out for sleeping? Of course, you have to clean them, I would assume. Any comments there?
What we normally recommend is that at night you take out your denture. Reason being is that the denture is placed, if you have a full denture, where it actually replicates the area of your mouth, especially the upper area. So you find that there's a compression mechanism taking place. So if with prolonged use and you don't take it out, when you do take it out, you see that there's a red area marking on the denture in the roof of your mouth. So we recommend that you take out the denture and actually massage the area to re-establish the blood flow in the roof of your mouth, so you can prevent the area becoming red and inflamed. So yes, you should take out the denture at night to give your whole mouth some breathing space so that the blood flow can be reestablished, and then next day you wear them again, so that if you have like inflamed gums, it means that when you use the denture, you're still going to be experiencing pain and everything, and then you eventually won't use the denture and say that they don't fit, because if you leave them out for too long, your mouth tends to change a bit, and then you're going to have issues that will end up like making a completely new set of dentures without using these set you have, because you're not wearing them all the time because you're having gum issues of the gum being weird and inflamed from the compression of the dentures.
Any specific recommendations for the cleaning of dentures as it compared to the cleaning of your regular teeth? You have any special recommendations? Is there any special techniques to follow? You know, you have to brush up and down and in between and so on and so forth, or is it just you clean it like you're cleaning the surface of anything else? The fact that it's on the outside, is there any suggestions and recommendations coming from dentists to persons for the cleansing of dentures? Dr. Rollins.
Yes, we do encourage patients to take their dentures out at night, and we encourage them to clean the denture. I guess it's just to remove any debris that may get lodged between your gums and the denture during the daytime when you were eating, and to just make sure that denture is clean. Make sure the teeth that if it is a partial denture, it is very important to clean the teeth that aid and support that denture. A lot of times we find that sometimes decay forms on teeth that support the denture, and they sometimes become compromised, and therefore your whole smile becomes compromised. You have to go and get a new denture made. So we do encourage patients to take those dentures out at night. Make sure your teeth are clean, make sure your gums are clean, make sure the denture is cleaned.
Is any specific techniques for cleaning dentures, or is just wipe down and brush off?
Just make sure the debris is taken off.
Yeah, I guess that's a lot easier than having to clean teeth inside of your mouth. Any other comments, Dr. Chris?
Yes, just like your natural teeth become stained sometimes from drinking coffee, dark stuff, we've seen that dentures also can build up of calculus can accumulate on your dentures also. So in instances like that, what we recommend sometimes is that persons visit the dental technician, the ones who make the dentures, and they can also help in cleaning these dentures, because sometimes you need specific instruments in terms of cleaning out the areas. We don't have those special instruments to clean the dentures, so most times we send the persons to the technician so that they can get the dentures properly cleaned. You know, some persons, their idea of having a denture is that they don't have to brush their teeth anymore. They don't have to worry about toothache anymore. So sometimes they just eat and just rinse out their mouth. They're not concerned about cleaning the denture properly. Their joy is that they don't have anything that's going to hurt them anymore. But not taking care of your denture, not cleaning your denture, you can also end up with infections on the tissues, the gum tissues underlying the dentures. So it's very important that proper care be taken of the dentures to avoid these problems.
You know, we often hear about the importance of fluoride. You know, once you're in the realm of dentistry, that substance, that name keeps coming back in ads and so on. Fluoride in this, fluoride in water, fluoride in toothpaste. Is fluoride in toothpaste something that is supposed to be beneficial, and why? Or if not, if it's harmful, should I or should I not be looking for a toothpaste with fluoride? Dr. Rollins.
Fluoride is that ingredient in the toothpaste that is supposed to be anti-cavity. It's cavity fighting, prevents cavity formation. It is recommended in a specific amount. Usually, if you look at the back of the toothpaste, it tells you the specific amount of fluoride that is contained in that toothpaste. We do encourage patients to buy a toothpaste that it contains fluoride. It helps, like I said, it helps to fight cavities. But it should be used in moderation. Usually when you place the toothpaste on the toothbrush, we expect a moderate amount of toothpaste to be placed on the toothbrush, usually a pea-sized amount, and not that whole wad of the whole length of the toothpaste sometimes you see on television. So once you do that, a moderate amount of toothpaste, you will be, you will have the amount of fluoride that's needed to fight the cavities, but not amount of fluoride that will be harmful to you.
But you'll be surprised, in this day and age, people sometimes bear in mind economics. I personally, and I'll give you all a little insight as to how I used to operate with toothpaste. I've seen ads where you have the length of the strip of toothpaste is the length of the brush. But I find that it tastes pretty strong if I use half that length. And I save, and many people I think would have followed that particular way of determining how much toothpaste goes on that brush. So is it important that quantity? Must it be at that whole long strip, Dr. Rollins?
No. To me, that is too much. It probably be too soapy as well if you realize in your mouth. So that's why we recommend a pea-sized amount. Probably
a dab.
No, maybe a little bit more than a dab. Probably like a pigeon pea size amount on your toothbrush. It should be adequate enough to have that right amount of fluoride that you need to fight the cavities.
Okay, Dr. Liva, you have comments on that?
Yes. The pea-sized amount is actually more geared to children when children are using toothpaste. And we also try to, because the child, they cannot control whether they should swallow or spit out. So we tend to we try not to use too much so that they don't actually choke on the toothpaste itself. And normally, when the child just starts to brush, we tend to ask you to use a non-fluoridated toothpaste until they are old enough so they can actually follow instructions and they can spit out the frost of the thing.
I guess with those smaller children, the parent will be doing the brushing.
The brushing, yeah.
Okay.
But then the fluoride is important because it actually helps to strengthen the teeth and prevent cavities from forming.
Yeah, I heard of a phenomenon now as it relates to the extraction process, the pulling of teeth and the use of coconut oil. That's new to me. I have no knowledge about that. Dr. Christmas, is that something that is spoken about only? Is it something actually done, the coconut oil use?
Well, there are many persons who are looking for alternative treatment for dental treatment. So you find persons who would have used the traditional methods where they use toothpaste and the different mouthwash and they're not getting the desired results. Some persons turn to this process that is called coconut pulling. It's actually, they use the coconut oil and they swish it around, try to get it in between the different teeth so that it's said to help with some sort of relief sometimes for persons with periodontal problems. But I can't say for sure the effectiveness of this coconut pulling.
Any comments, Dr. Rollins, on that part? I never heard of it. That's news to me. It makes me wonder if I should go on my coconut trees and do some picking and some trying to see what it will do with my teeth. So it will help with the preservation of the teeth or what? Any comments there?
A few patients have indicated that they do practice this. They do this practice, and they say that it helps, like Dr. Christmas was saying, in terms of killing bacteria and help to improve your overall oral health situation.
So that's the coconut oil itself?
Yes. I was reading about it also. They said that you put a teaspoon of coconut oil in your mouth for about 10 to 20 minutes and you just swish it around. Some persons have said that it gives a fresher breath. Some persons have said that the teeth are whiter. There's also a claim that it prevents cavities, but that part I cannot be sure if that has been proven that it does prevent cavities.
Okay, as we are drawing down to the close, I want us to look at fillings and this amalgam, the silver fillings. There's lots of talk about the content of those silver-looking fillings. You know, you hear the talk about, is it mercury or is it not? And the safety, because we constantly are bombarded with news items in relation to safety issues regarding mercury in particular. So, amalgam fillings. Dr. Leibel, give us a little insight. What's the story here?
Okay, silver amalgam fillings, they were traditionally used for the posterior teeth, the back teeth, back in the day, but with the development of technology, you have what we call composite resins. Initially, they were used for the anterior teeth, but nowadays you're actually making the composite resins with the same strength as the silver fillings. The issue with the silver fillings is sometimes over a period of time they tend to discolor and change from silver to black, and then if there's a fracture, you're going to have leakage taking place, so all the food or the liquid going to go down in the fracture, and then you can develop what we call secondary caries, where the tooth start hurting all over again because of the fracture. And probably by the time you actually attend to this tooth, the silver filling is fractured. Because, you know, metal, with heat they expand and with cold it's a contract, so with that happening over a period of time, fractures can take place.
Okay.
So then by the time you go and actually change that filling, it's too far gone down into the nerves and the pulp of the tooth, and then you might have to get either a root canal or the tooth extracted. But in their time back in the day, they were useful, but then what we have now is what we call the mini-matter convention, where they're trying to eliminate all mercury content, be it in the fluorescent lights and like the silver fillings, and St. Kitts has signed on to this mini-matter convention. So, well, I normally order for the government service, and for years now we have stopped using the silver amalgam filling because of the issue of whether there's leakage with the mercury and if it's harmful to the patient, and also for aesthetic reasons, because sometimes you find patients, when they smile out there, they laugh loudly, and so you see all the black things, and people tend to think that, you still have cavities, when it's actually the fillings that have discolored over a period of time.
But you have any personal experience with the use of those silver fillings since you've been back working?
No, but I have patients who had silver fillings done over a period of time, and then there comes back what we call amalgam tattoo, where there might be an overhang of the filling or probably like fracture and leakage, and then the gum itself, you see like a black spot like on the gum, but that's because the silver filling was either rubbing on that area, and like you actually like stain that area of the gum there. Where it's supposed to be pink, you actually see there's a black spot, and that's called amalgam tattoo.
Mm-hmm. Yeah. Any other comments in relation to the amalgam fillings and the safety profile, Dr. Rollins? Anything you want to add?
Well, in terms of what Dr. Leibel was saying, another reason too we probably stop using them is demand also. Most times patients specifically ask you, well, what type of filling do you have, the white one or the dark one? So we say the white one, and they are quite pleased about that. So the demand is there for the higher demand is there for the white colored filling as opposed to the darker colored fillings.
And in our government dental clinics here in St. Kitts, we have the white filling. Yes, we have. Because I wasn't sure. It's good to know that we up to date with technology in St. Kitts. All right. I have a question here in relation to fillings, and I have it phrased this way. We often change our glasses every so many years. Does that phenomenon also take place with fillings? Do we have to change fillings, or once you put a filling in, that is it? From my little browsing around on the internet, I get the impression that after a while fillings may drop out or do different things and may require change. Or someone may come in and determine right now that they had an amalgam filling and they want it out and replaced. What's the story with the changing of fillings, the duration, how long they last, and if there's something that I can just request, I just want a different filling? Dr. Leiber.
Okay, normally when we do a filling, it's supposed to last from a minute to a lifetime, but you know, over a period of time with normal wear and tear, like things can get bad. But also, one of the main reasons that a filling might need changing is based on eating habits, where like you might be accustomed to biting bones, and then the filling get fractured, and then like because the filling is fractured, you might have to replace that filling. What we try not to encourage is that every time you have to do a filling, you have to go and cut more tooth structure. So you sort of essentially, for lack of a better word, like weaken the tooth itself. Because we try to preserve as much tooth structure as possible when we're preparing the cavity to do a filling, because it's like building a house. You need a proper foundation for the building itself to hold. So each tooth have a different type of cavity preparation in order to house that filling. As long as the cavity preparation is done properly, then the filling should not fall out. But over the period of time, normal wear and tear and eating habits, like that can happen, where your tooth get fractured and then get dislodged and might have to be replaced.
Yeah, any comments to that, Dr. Christmas?
Fillings do need changing periodically over time, because especially the anterior filling, sometimes you find a patient who is into drinking coffee, wine, these things, you find the filling itself can become discolored over time. So it's necessary to change these fillings. Also,
is necessary or is recommended?
It's recommended because it's obvious, especially if it's like in a front tooth. You can see when we do fillings, the whole idea behind it is to blend the filling into the tooth. So I shouldn't be able to look at you and see that you have a filling. But then over time with age and also with material, you find sometimes the material becomes obvious. So the minute you smile, persons can see that you have a filling in a particular tooth. So in cases like that, we would recommend that you change the fillings. Sometimes also the position that a filling is in. You find a tooth might be constantly rubbed from another tooth, just from the biting forces, and that could wear that particular area of the filling down. So in cases like those, it's also recommended that you change that filling.
But can I just come in and say, look, I just want this filling change? Is that something that normally is done, that you encounter those situations where a patient comes and they just prefer, you know, a change? They saw some design and they determine, well, I want that kind of filling in my mouth.
What normally happens, especially with the silver patient will come and say, oh, I had this filling a long time ago, can I get it changed? And what we tend to do is like, the filling is already there. If it's not fractured, then we try not to change it. But it's not that it cannot be changed, because nowadays with technology and all the selfies and everything, persons want to look good in their photos. So they don't want to, when they smile, they see the silver or black thing in their mouth. So for aesthetic reasons, yes, we would change the filling, but it's not that we just go about changing just like that. Like the reason have to be convincing to the dentist that we should change the filling. No. Because if it's not broken, why fix it?
Okay, we are at almost at the top of the hour, and so we want to do a quick wrap up. But in that wrap up, I want Dr. Rollins to give me a quick insight as to the usefulness, if it has to be each time, when it comes to fillings and so on, the drills. Do we need to be drilling each time? You know, is there any way to get around, to circumvent the drilling part? Because lots of people fear the drill. In your wrap-up, we have only 2 minutes more.
In terms of you're replacing a filling?
You're replacing a filling, you know.
Sometimes, yes. If you were replacing a filling and there is some level of decay present, you would need the drill to remove that level of decay in preparation to place a new brand filling. So sometimes you can use a hand instrument. It might be successful enough to be soft enough to remove that new decay. But in other times, the drill or the hand need to be utilized to remove the decay that's there.
Yeah, any final comments, Dr. Liebert?
Yeah, I just want to stress the importance of brushing and also mention that it's also important to brush before going to bed, especially before going to bed. Some person might say, like, why brush my teeth if I already had supper and brush my teeth and then I chill a while and anything I still have to brush my teeth. Everybody have bacteria in their mouth. So you find that during the day you're active, your tongue is moving, so it's salivating, so that helps to reduce the bacterial count and neutralize the bacteria in your mouth. But in the night, you don't have that tongue action taking place. So find that the bacteria capitalize and builds up in your mouth, so in the morning, you feel that sticky phlegm. So it's important to brush your teeth to reduce the amount of bacteria in your mouth, because it's a cycle where you have to have bacteria build up in your mouth, food live on your teeth for a certain length of time in order for cavities to form.
Dr. Christmas, 30 seconds, parting shots,
some
final
persons,
salvo.
Some persons, they boast sometimes to say that they haven't been to the dentist in years, but that's not a good boast. I would just like to recommend that you visit the dentist at least twice per year. Sometimes you don't feel pain, you don't see anything is wrong, but it's very important to visit the dentist, because from there we're able to identify possible problems that's going on inside the mouth.
Okay.
And the dentists are not scary as you would have heard.
Okay, thank you very much, lady and gentlemen, for the presentation tonight, clearing up some of the issues, some of the concerns that we have about visits to the dentist. And in parting, I just want to remind the general public that we are still in the pandemic, COVID-19, and as such, it is imperative that we follow the recommendations that have been well studied by scientists, by the experts, and which have been proven to lower your chances of encountering the coronavirus, the COVID-19. And that is to say the hand washing, sanitizing, the wearing of the mask, and keeping that distance. That virus, if you are miles away from the other person, cannot get to you. You have to be right up, under the person. So keeping that distance, washing your hands if those hands get contaminated, and having that mask on. If, of course, you don't have to go to the party, you really and truly would be safer at home. Our idea is to try and keep our numbers down, keep our numbers to an all-time low. The United States right now has over 12 million cases. India over 9 million. The top 1 million countries, the top countries with over 1 million cases go from the United States, India, Brazil, France, Russia, Spain, United Kingdom, Italy, Argentina, Colombia, and Mexico. They all have exceeded 1 million cases. And we are trying our best. We are now at 20, and we would hope that we can stay at 20 for a long time. And this can only be achieved if we follow those golden rules. A vaccine is supposed to be on its way shortly, but that shortly, we don't know how long is that shortly. So we must wash those hands, wear your mask, keep your distance, and stay tuned to HealthWise, the program organized by the St. Kitts Nevis Medical and Dental Association. I just want to say thanks for viewing, thanks for watching, and we will definitely be with you on another program in another week. Good evening.